Today's topic is hypoglossal nerve. I'm Dr. Mohammad Sharjeel Ilyas, Assistant Professor, PGMI, AMC Lahore. Objectives of today's topic is to learn nucleus of the nerve, course of the nerve, anatomical course, branches of the hypoglossal nerve, formation of ansa cervicalis, and how it helps to form this part of cervical plexus, and applied as aspects. Hypoglossal nerve is a pure motor nerve and it arises from the hypoglossus nucleus present in medulla oblongata of the brainstem. This is pure motor, so the nerve is also a pure motor. It passes laterally in across the posterior cranial fossa within the subarachnoid space. The nerve exits the cranium via hypoglossal canal, pointed in the picture. Hypoglossal nucleus is the main nucleus of this nerve and passes laterally to reach the hypoglossal canal, and then extracranial courses the nerve receives a branch of the cervical plexus as it comes out from canal. This branch of or this nerve of cervical plexus only accompany with this nerve, or hypoglossal nerve only carries these fibers of cervical plexus and they are not part of hypoglossal canal. Then the nerve passes inferiorly to the angle of the mandible and it crosses the internal and external carotid arteries moving in an anterior direction to enter the tongue. There are three main branches of this nerve. First of all, meningeal branch. It supplies geometry on the floor of the posterior cranial fossa and posterior wall of the posterior cranial fossa. The second one is superior root of the ansa cervicalis. Uh, it supplies three muscles: sternohyoid muscle, sternothyroid muscle, omohyoid muscle. They are all depressor of hyoid bone. While the main or terminal lingual branch is uh, of hypoglossal nerve supplies all intrinsic muscles of the tongue, like superior oblique, inferior oblique, transverse, and vertical. While three out of four muscles, extrinsic muscles, genioglossus, hyoglossus, and stologlossus, are supplied by hypoglossal nerve. Only palatoglossus muscle remains, which is supplied by vagus nerve. There are also two muscles, genohyoid and thyrohyoid, which are supplied by these terminal branches. One by one, we see that now the hypoglossal nerve comes out from the hypoglossal nucleus, travels its course, and reaches to the genioglossus muscle, then hyoglossus muscle, and styloglossus muscles. These three are extrinsic muscles of the tongue. Only palatoglossus remains, which is supplied by vagus nerve. And all the intrinsic muscles of the tongue are supplied by hypoglossal nerve, including superior oblique muscle, inferior oblique muscle, vertical muscles, and transverse muscle group. Then one of the branch coming out from C1 to C2 also provides innervation to the genohyoid and thyrohyoid. This is picture of formation of ansa cervicalis. Hypoglossal nerve is shown in yellow color and its terminal branches obviously supply the muscles of the tongue, while the green color branches coming out from the spinal roots of C1, C2, and they come out to supply geniohyoid and thyroid muscle, and ansa cervicalis itself supply superior belly of omohyoid, inferior belly of omohyoid, sternohyoid, and sternothyroid muscles. How it forms, like in green color, it is hypoglossal nerve, and these are three roots from C1 to C3 anterior MI of the spinal nerves. They combine to form ansa cervicalis, shown in green. It has two roots, an inferior root and a superior root. superior root is obviously related to the hypoglossal, and here it supplies the omohyoid muscle. Actually, superior belly and inferior belly both are supplied by C1 to C3 roots with the help of then sternocleidomastoid and sternothyroid muscle. Now, the examination of hypoglossal nerve, it's very simple. You just ask the patient to protrude his or her tongue, and if the tongue deviates on either side, right or left, then there will be an injury to that side. This is a case representation. Ask the patient to protrude the tongue, it deviates to the right side, shown by the white arrow. After 3 months, the patient is treated of the palsy. So this is all about the hypoglossal nerve. Thank you so much.